fatigue clinic here at UF, and we developed this fatigue clinic because up to 80% of patients who have MS experience fatigue.
The brain lives in the body, and we have to take care of our body in order to take care of our MS ultimately. And so that's important for patients with MS to get their cardiovascular fitness. We think that not only will it help your body, but it will help your brain as well.
It's a multidisciplinary approach. We have physical therapy involved, occupational therapy involved, nursing, and then the doctors, of course.
Fatigue has different clinical manifestations. We can identify two main groups of symptoms in fatigue. One is what we call the mental fatigue, also known as a psychosocial fatigue component. And that has to do with when patients develop difficulty concentrating, difficulty keeping attention for a long period of times, sometimes difficulty with executive functioning. And that mental fatigue is usually known as the brain fog by the patients, in which they usually feel that as the day progresses, they have difficulties with multitasking, with higher cognitive functioning. The second group of fatigue symptoms is what we call muscle fatigue, and that has to do with the fatigability of the muscles to keep endurance and physical activity over time. And usually patients will endorse that as the day progresses, they feel that the muscles cannot keep up with the activities of the daily life. And patients may have both types of fatigue, patients may have one or none. And as the disease progresses, patients may develop different type of combinations of that. It's important to distinguish which type of fatigue patients have, because the causes as well as the treatment may be different.
Possible causes of fatigue in patients with MS are poor sleep habits, difficulty with activities of daily living, sort of a disability, if you will, other comorbid medical conditions such as anemia or low blood counts, thyroid disorders. Patients with MS often deal with heat difficulties. They experience an exacerbation of their symptoms. So we often recommend staying in cool air conditioning, exercising in the air conditioning. If they're outside on the sidelines for their children's games, being under a tent. Oftentimes they bring portable fans with them, just hand fans and everything. There are things that they can purchase that wrap around their neck, cooling neck blanket or cooling vest that they could use as well, if as a worst case scenario. Depression and anxiety is a big one, depression specifically. So I talk to patients a lot about depression, if they have good family support. We talk about if they need medications and that there's really no stigma related to those medications.
And that's a really intertwined subject, and it's very hard to suss out in a lot of people what is actual depression and what is fatigue in this population. There are other confounders too. In terms of a lot of medical conditions can cause fatigue, and patients with MS are more prone to these conditions. Deconditioning is one of them, where you basically, by not moving as much, you lose the ability, your muscles get weak, they're not as strong, and so it's really getting those patients to move again that's really important for that aspect of fatigue. And ultimately, I think it goes onto that line of neuroprotection and neurorehabilitation. Not only that, we think that it will help the brain grow. So it's very important overall for patients to get their cardiovascular fitness in. It's important for them to work with their provider to sort of figure out a plan on how they can best get that, given their current situation.
What happens in MS is the immune cells are believed to drive the pathology of the disease. So something triggers the immune system to go to the brain and recognize brain cells or parts of those brain cells, antigens, something they need to respond against. In that process, there is some permanent damage that occurs in the brain. And we can actually see that and measure that when we do MRIs and we see lesions. One of the consequences of that is that now the brain functioning has to restructure itself. And there is some what we call plasticity happens, that areas that has been affected with MS lesions, now they cannot function properly. So other areas will have to pick up that function and compensate for that. There is a concept known as brain reserve that we all have. patients with MS or without MS have. And that brain reserve means that there is a functional component of the brain that is intended to compensate for damage, compensate for normal aging, and compensate for other potential problems in the brain. So as the disease evolves, patients continue to use the brain reserve to compensate for the loss of function in the areas that has been affected with multiple sclerosis lesions. So what happens over time is that as we keep using the brain reserve, we exhaust the ability of the brain to compensate. And one of the consequences of that is fatigue. That usually occurs later on in the stage of the disease. If you look at your brain as a bank account, and I usually do this comparison with patients, you have two types of brain. The brain that we use for daily activities, the check-ins in the bank account, and then we have your savings, which is the brain reserve. So we use the check-ins to function on a day-to-day basis, to pay the bills and to buy groceries. We use that part of the brain that is estimated to be 10% of our functional brain to do the things we need to do on a daily basis.
One of the things that we're looking at the research related to the new medication that came out, Ocrevus or ocrelizumab, is that specifically looking at its relation to fatigue. There was 2 studies done, one in patients with relapsing remitting MS and one in primary progressive MS. And they actually showed that in primary progressive MS, it helped with fatigue in those patients that responded to the medication. Now, specifically, we're looking at the relapsing remitting patients because the data isn't there yet to show that it helps with fatigue. And the reason that's important is because while we've had really efficacious medications come out in the past, we haven't been able to show yet that that's helped with fatigue, which is the most debilitating aspect of this condition for most people.
We advocate for highly effective therapies early on in multiple sclerosis to make sure that we preserve that brain. We preserve the brain reserve as much as we can early on. One of the questions that patients often ask is, can I build brain reserve over time? I know that I'm losing that. Can I do something in order to stop it? But what about building more brain reserve? And the answer is yes, and we can all do that, with or without MS. And that's why we always recommend patients to engage into healthy habits. One of the easiest ways to stimulate the brain is using it. The brain is one of those few organs that the more you use it, the better it gets. And that's why cognitive activities, learning new things, challenge your brain in learning new functions every day. Learning new instruments or languages or keeping an active life usually helps. The other way that we can build brain reserve is through physical activity. So every time we move a muscle, we are challenging the brain to get smarter. Particularly if you have an area of weakness or disability due to your multiple sclerosis, the concept of physical therapy is that the more you use and the more you challenge that function, you're forcing your brain to rewire itself. And in that process, it will get smarter over time. So that's the basis for cognitive behavioral therapies, that's the basis for physical therapy to enhance brain function over time.